Welcome to all viewers and well-wisher of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. The motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now to return a lot to the word. Topic of today is Warts. Warts, the other name is verruca papillomas, small, rough and hard growth, similar in color to the rest of the skin, caused by the infection with the human papilloma virus, HPV, so it is contagious. Warts can spread by contact with wart or something that touched wart, found on the hands, feet, face, genitals, knees, on other locations also. It can be single or multiple. Virus enter the body through skin that is damaged slightly and they are not cancerous. The warts, as one can see, that can be plantar on the foot, periangle on the finger, common wart anywhere on the body, flat wart, and then one can have the genital warts. These are found on the shaft of the penis and in case of the female, vagina, vulva or the cervix or around the anus. This is the structure of the wart. It is having capsid protein L1, then it has got histone, and then it has got its genome or the DNA, which is genomic DNA. Then it has a covering which covers the DNA, that is the capsid protein L2. So here are the different kinds of the wart. It is here HP11, HP6, HP16 and HP18. Warts are very common. Non-genital warts is about 1 to 13%. Most people being infected at some point in their life with the wart and with HPV virus and having the wart. More common among the young people. Genital wart in sexually active women is about 12%. Before HPV vaccine, rate of the genital wart in sexually active women were about 12%. Warts have been described back as 400 BC by Hippocrates. So the causes, the warts are human papilloma virus or HPV. HPV infects squamous epithelium of the skin or the genitals. Each HPV type infects the specific area on the body, mean certain types of the warts infect the certain parts of the body. There are about 130 types of the human papilloma virus, where HPV are of two types. Low risk types cause warts and the high risk cause the cervical cancer, vulvar cancer, vaginal cancer, penile, anal and oropharyngeal cancer. So these are all called high risk papilloma. So the common warts are due to HPV type 2 and 4 mostly, also type 1, 3, 26, 29 and 57 and others are also notorious for causing the common warts. Verruca plana or the flat warts are due to the HPV type 3, 10 and 28. Plantar warts, verruca, are due to HPV type 1 mostly and also type 2, 3, 4, 27, 28 and 58 are also notorious for causing this problem. Butcher's warts is because of the HPV type 7 and anogenital warts, pandylomata accumulata or venereal warts are due to HPV type 6 and 11 mostly, but also types 42, 44 and other contribute to have this anogenital wart. Hex disease, focal epithelial hyperplasia, it is because of the HPV type 13 and 32. Now here is the HPV human papilloma virus, and as I have already told you the structure of that, so it got the major capsid protein L1, and here are the other types of the viruses: HPV6, HPV11, HPV16, and HPV18. Now, how these viruses do spread? The virus can spread from person to person or from different parts of the body through direct contact with the wart, touching something contaminated with virus such as the towels, doorknobs, and shower floors which are contaminated with the virus can spread the disease. Sexual intercourse responsible for the genital warts, and the nail biting and cuticle pricking, which is very much habit of the children, and they are also causing the spread of the. Then shaving is also one of the mode of spread of these warts. Now, the risk factor: children and the teens, as they get a lot of cuts. People who bite their nail or pick at the fingernails, they are habit of having this kind of biting the nails. And people with a weakened immune system, they are also prone to have this HPV infection. Cut or scrape on the skin, more common on the body parts that the people shave, like beard area in men and legs in the women. So the people with the autoimmune disease or the elderly are more prone. Use of the public showers, working with meat, and frequently getting the hand wet in their profession, hands or feet that sweat heavily, the condition which is called hyperhidrosis. They people are also very much prone to have this problem of warts. Swimming in the public swimming pools. Now, HPV risk factor, as one can see, the weakened immune system, the elderly, sexual behavior, sexual intercourse, personal contact with the people with having the wart on their different parts of the hand, and the damaged site of the skin is very much prone to have the warts. Now, resistance of the virus. The virus is very hard and immune to the many common disinfectants. They are resistant to the dyeing and the heat, but these are killed and disinfected by 100-degree temperature or 212 Fahrenheit and ultraviolet radiation. Exposure to the 90% ethanol for at least 1 minute can also kill the virus, and also 2% glutaraldehyde and 30% Savalon and 1% sodium hypochlorite is able to kill the virus. Now, anyone can count the seed in an apple because it is very easy to count the seed in an apple. You cut the seed and you cut the apple and get the seed out and count them. But only the God can count the number of apples in a seed. The seed, when it becomes a tree, it has lot of apples on that, and how many apples are there in one tree, it is only the God knows. Now, the pathophysiology of the wart. On dermoscopic examination, warts have finger-like or knob-like extensions. Common warts under microscope cause and show thickening of the stratum corneum, so it is called hyperkeratosis. Thickening of the stratum spinosum, the acanthosis. These are the layer of the epidermis. Thickening of the stratum granulosum, ridge elongation, and the large blood vessels at dermoepidermal junction. These are the features which one can see on cutting the wart. Here one can see how the human papilloma virus that just enters via the break in epithelium, and the virus just reach the basal layer of the basal cells of the epidermis. Here the high risk types cause thickening and the basal and upper layers, and then virus start moving upward, and the low risk type cause thickening mostly in the upper layers. The high risk cause the thickening in the lower layer, and the high risk are gone. Now, the virus, as it has reached to the basal layer, infects the squamous epithelial basal cells, and I have told you the high risk, the lower layer, and the low risk, the upper. Now, virus stimulates the cell growth of the epidermis, and ultimately the common wart appears, and virions are packed and released from the upper layers. Here one can see after making the common wart, the viruses get released from there, and now they are capable of infecting the other cells and the other people. Here one can also see the infection of, of the basal layers, then it goes to the spinosum and grows, and then it goes to the granulosum layers, and ultimately to the upper layers, the stratum corneum, and then it is going to make the wart, and the excess, they are being released, and they are going to replicate and then can infect the other layers. So basically they just infect the basal keratinocytes, and from there it just go to the upper layers, and from the upper to the topmost layers, and to cause the wart and releasing of the new viruses which are being formed here in these cells, and they are going to be infecting the new layers. Now, what are the symptoms? It takes months to years to develop a wart, but in healthy people, it causes no symptom except one in the bottom of the feet, so they are painful on walking. Warts vary in appearance. They may look like dome-shaped, flat, rough, skin-colored, brown-colored, gray or black. They are usually painless, small, rough skin growth, which are in the form of wart. Now the types of the warts, it depends upon the shape and the site affected. There are about 9 types which have been seen, and the number 1 is common wart called verruca vulgaris, flat wart, verruca plana, filiform or digitate wart, plantar wart, verruca plantaris, or periangular wart, mosaic wart, genital wart, venereal wart, condylomata communita or verruca communita are the other names for these genital wart. Then butcher's wart, and the last is the Hex disease. Now we are coming to the common wart, which is called verruca vulgaris. It is the most common type, sometimes called palmer wart or the junior wart. A raised wart with roughened surface, mostly on the hands, face, or anywhere on the body, like fingers shape around nails, backs of the hand, and virus cause the warts spread from hand to hand through touch or the nail biting. More common where skin was broken, biting or the pricking fingernails, as I have already told you, can have the black dots that look like seeds, so often called seed warts because of the appearance looking like seed. Here one can see the common wart on the finger and verruca vulgaris. These are seen mostly on the finger and on the hand, as one can appreciate. Now the number 2 flat wart is called verruca plana. These are small, smooth, flattened wart, white or flesh colored, grow in large number, about 20 to 100 at one time, mostly on the face, neck, hands, wrist, and the knees, or the exposed surfaces of the body, seen mostly in the teens and the children on face. Men get beard area and women on their legs, which is being used for the shaving. Shaving promotes their spread, so these people should avoid using the razor, and therefore should opt for other way of removing hairs like creams or the bleach or other way of removing the hairs. HIV weakens immune system, so body cannot fight virus that causes warts. So they people are also very prone to have these warts. Here one can see the flat wart on the face, and here again on the cheeks, and here the flat parts on the back of the hand, and here on the face. So many, as I have told you, about 20 to 100 in number. They are found on the face, neck, arms, back of the hand, and the legs. And mostly, as one can see, they are having the flat appearance. The third form is filiform or digitate wart, a thread or finger-like wart, and mostly on the face, especially near the eyelids and the lips. Often grows quickly on the face, around mouth, eyes, and nose. As one can see, these are filiform or digitate because of the name, finger-like projection coming out, and these are mostly on the face. Now the fourth type is plantar wart, which is also called verruca plantaris, also called foot warts because they grow mostly on the soles, so on the plantar surface of the foot. For these reasons, these are called foot wart. A hard, painful lump with multiple black specks in the center on the soles of the feet, only found on the pressure point on the soles of the feet. They are painful and grow in cluster, so these are called in that condition the mosaic warts. They can hurt, feel like the pebbles in the shoes, and give you the pain of that pebbles in the shoes. They are flat or grow inward. When the walking creates pressure which causes wart to grow inward, so these cause the pain. They spread in showers, while taking bath in the showers, gyms, or areas where barefoot walking is common, so they people are prone to have the wart because of these areas. And here one can see the plantar wart, verruca plantaris, on the plantar surface of the foot, so that's why they are called plantar warts. Number 5 is periungual part. As the name is, periungual mean around the finger. A cauliflower-like cluster of warts occurs around the nail. Periungual means around, and subungual means under the fingernail and the toenails. As one can appreciate, this is subungual, and here it is periungual around the nails, so that is the periungual. Now the 7th type is mosaic wart. It is a group of tightly clustered plantar type warts and found on the hands or the soles of the feet, as one can see. So they are multiple wart. Every wart has its own supply of the blood and the nerves, and these are just the solitary wart, and here when they are in cluster they are called mosaic wart. And here one can see the mosaic wart. Expansion of the plantar wart can make the mosaic wart, and here there is only the plantar wart. The 7th type of the wart is the genital wart, also called venereal wart, condyloma accuminatum, or verruca accuminata. A wart on the genitalia, most commonly, or it's the most common form of that sexually transmitted infection. Women are more prone to develop genital warts, causing cervical cancer, and they cause pain, itching, and distress in the genitalia. Vaccine available now to prevent genital warts. Previously it was not available, so one can just prevent the cancer by having this vaccine. Female children can also have the genital warts contracted from the mother or from the hand of the caregiver. Now, here one can see the genital warts, and these are here in the female vagina, and in case of the male, it is on the shaft of the penis, and here again one can see the wart on the anus, and wall on the vulva and on the around the vagina, and how these genital warts are formed. The HPV virus that invades the skin, and when it invades the skin, the DNA from the virus enters the skin cells, and these skin cells start multiplying, and here one can see the virus is infecting the many cells of the skin. Now HPV causes the infected skin cells to multiply and form warts. So these cells just make the wart, as one can see, and these cells in which these HPV viruses are multiplying, ultimately they leave the cells and virus sheds and passing on to the others. Here one can see the release of the virus from the skin after making the wart, so infecting the other. So one can see the HPV infecting the skin cells, multiply in the skin cells, and the many cells, they are just taking part in forming the wart, and the rest of the viruses which are multiplying and they are coming out of the cell, they are capable of infecting the other person and other tissue. Now the number 8 is the butcher warts. It's a cutaneous skin condition seen 8.5 to 23.8% butchers and other meat handlers, professions, which are caused by the human papillomavirus 7. As you can see, the warts on the hand of the person, those who are involved in this butcher's profession, and you can also appreciate the wart. These are all warts. These are called butcher's wart. Number 9 is the Hex disease. It is also called focal epithelial hyperplasia. It is an asymptomatic benign neoplastic condition characterized by the multiple white to pinkish papules seen diffusely in the oral cavity, as one can appreciate here in the lower lip, the multiple warts, and these are basically the focal epithelial hyperplasia presenting like the wart, and that is called the Hex disease. So these are the different types of the warts which are shown diagrammatically. As one can see, the common wart, it is just coming out as protuberance on the skin. Then there is the plain wart. These are plain in shape, and here these are the plantar shape. These are on the plantar surface of the foot, and here these are the genital. These are coming out, and here these are the filiform, the finger-like, and here this is digitate. As one can see, these are like the digits, so the shapes of the different types of the viruses diagrammatically. Now, what the complication the warts can do? Most warts cause no problem, or they hurt, but sometime if they are on that part which is under pressure, it causes different cancer like anal cancer, cervical cancer, and throat oropharyngeal cancer. And to lower the risk of the genital warts, get the HPV vaccine, which is now available by the name of Gardasil, and use condom to avoid the spread of the genital wart. Disfigurement is caused by the wart. People with a weak immune system develop cluster of the wart on the hands, face, and body, causing the disfigurement. Infection can occur if one pick or cut a wart, and to invite the infection, break in the skin allow bacteria to enter, causing the bacterial infection and ultimately the pain. Otherwise, they are not causing any problem. Pain occurs if plantar wart grows inward into the foot and cause pain on walking, and one feel as a pebble under the skin, as I have already told you.